In this rugged land of blue lakes and heather barrens, Nova Scotia, New Scotland, this is Nova Scotia.
Nova Scotia, the little province that could. 16,872. That's how many strep throat tests our pharmacies have conducted since the spring alone. 75,168. That's how many Nova Scotians have accessed our urgent treatment centers in just over a year. And 250,000. That's the amount of red tape hours we've freed up for doctors so they can do what they're best at, seeing their patients. Nova Scotia is not just a little province that could. Today, we are the little province that did. And here's how we're doing it. To start on the road to fixing healthcare, we did the most basic, simple thing. We listened. Along with our healthcare leadership team, I toured the province, engaging with dedicated healthcare workers in their communities. We learned a lot by listening to our local Nova Scotia healthcare professionals. But we also looked for the best practices globally. In the UK, we learned about a healthcare app that inspired our own Your Health NS app. In Copenhagen, we learned about a 911 technology, and now we're piloting a version of that in our own ambulance system. And in Princeton, we learned about patient engagement software that Nova Scotians will soon benefit from. By listening and watching, I've learned a lot. And I'm not embarrassed to say I'm still learning, but we are also getting things done. Here's the roadmap. More healthcare workers, new and more ways to access care, technology that puts the patient first, and using and analyzing actual data to drive decision-making. For decades, our communities, in particular our rural communities, have needed more doctors. We've taken bold action to address the shortage. First, we looked at training more doctors. We asked, how can we address the issue within our own borders? That's why we're opening a new medical school at Cape Breton University. This medical school will train 30 new doctors every year, and these doctors will practice exclusively in rural Nova Scotia. Likewise with nurses. But we need to keep the ones we have. We also need to bring in more, a lot more. So we've been laser focused on retention and attraction. And look, I'm biased here, but it's a pretty easy sell to convince someone to come to Nova Scotia. But you know what else helps? Fair compensation and the show of respect. We've addressed the elephant in the room, an immediate CCA pay raise, a bonus for nurses, and then a fair contract where 88% voted in favor, a bonus for paramedics, and then a fair contract with a raise. In fact, we paid a healthcare bonus for every single employee in our public system, including kitchen staff, custodial workers, and all of the other unsung heroes who keep the system running. And earlier this year, we signed a new contract with Doctors Nova Scotia. These contracts were critical to stabilize the system today. But we also had to look to the long term, and once and for all fix the old rules and red tape that prevents our healthcare professionals from working to the full scope of their abilities. It's silly to have people who are trained to do a job, who want to do a job, but just can't because of some silly rule. Look, I might not be able to directly treat patients, but my team and I do have a say in fixing those rules to make it easier for those who can. So we passed a law, the Patient Access to Care Act. The Patient Access to Care Act is a game changer. It does three things that will help fix healthcare. First, common sense credentialing. Second, expansion of scope for allied healthcare professionals. And third, red tape reduction. In terms of common sense credentialing, we've made it the law that if you can pass your exams and work as a doctor or a nurse or a variety of other healthcare professionals in good standing in certain countries, then you can in Nova Scotia too. Good enough for the UK, the US, Australia, the Philippines, good enough for Nova Scotia. On May 1st, we had openings for 1,500 nurses. Since the passing of this law, we've had over 19,000 applications for nurses from all over the world who want to come and work in Nova Scotia. This common sense approach to credentialing is already working. The Patient Access to Care Act allows us also to expand the scope of what our healthcare professionals are able to do. Now, in Nova Scotia, nurse practitioners can admit and discharge and issue certain prescriptions. Physiotherapists are now in emergency departments. They can prescribe x-rays and tests. Pharmacists can diagnose, treat, and prescribe for a wide range of common illnesses, like the nearly 17,000 strep tests that they have administered. The Patient Access to Care Act also attacks needless, time-wasting red tape. Nobody goes to medical school to specialize in paperwork. Before we took office, Nova Scotian doctors would spend over 400,000 hours on red tape. That's in the range of an additional 2.5 million appointment slots that could be opened every single year. So we work with doctors to identify the red tape and get rid of it. Getting rid of red tape is the law under the Patient Access to Care Act. And we started internally. We've gone through methodically through department by department to identify the red tape. In one department alone, they had 21 different forms doctors had to complete. We figured out what wasn't necessary. We got it down to just one. So far, we've eliminated 250,000 hours of those red tape hours. And this means more time available for doctors to do what they're best at, seeing their patients. We are leading the way nationally in establishing new and more ways to get you the care you need. To do this, we found the problem solvers in the healthcare system and we worked with them to build these new access points. We brought everyone to the table to find new ways for you to access care. Let's find what those ways to act are and let's get them done. We worked with the Pharmacy Association to open up pharmacy clinics, and so far they've treated 103,000 Nova Scotians. We worked with Dr. John Ross, a physician leader, to develop mobile clinics that travel the province and deliver care. Over 13,000 Nova Scotians have accessed care via mobile clinics. We created 7 urgent treatment centers across the province. These clinics have seen 75,000 Nova Scotians in just over a year. Many Nova Scotians go to the emergency departments to access primary care. So we've provided them with another option by building virtual care booths in our emergency departments. Sometimes it's as simple as a prescription renewal. They speak to a doctor virtually. The prescription is called in and they can leave. Each of these changes is a small improvement on their own, but together they are transformative. Technology. How can we make sure that we use technology to put patients first? Here's how. We're all sitting around with phones in our pockets. We can use them to call for a ride or order a pizza. So why can't we use them to access better healthcare as well? Well, in Nova Scotia, and how you can, we call it the Your Health NS app. It's a true one-stop shop for access. Through this app, you can use your phone to book appointments for tests, get access to mental health and addiction supports, check emergency department wait times, get access to primary care. The app will ask you your symptoms and will give you the best options based on your symptoms and your location. If your symptoms are something that can be treated at a pharmacy, it will give you a list of the pharmacy clinics in your area and will let you make a same-day appointment. If you can't get to the pharmacy, it might point you to a mobile clinic or an urgent treatment center. If none of these are right for you, then you have access to the healthcare provider right in the app, by video or by phone. Throughout the last 2 years, we've also learned that people want more information so they can take more control over their healthcare. We are on a mission to empower the patient to see the unseen. All the patient's personal information, if they want it, in their hand securely. We're committed to providing Nova Scotians the information they need to really engage in their own wellness. And as we build homegrown Nova Scotian healthcare technologies, we're also keeping our eyes on the horizon as well. We've launched a health innovation hub where brilliant, innovative thinkers from around the world have come together in one place to create, to innovate, to solve. My one direction to the team was anything that is built in our innovation hub, that better be something that we want in Nova Scotia and that we will be first adopters of, because that's what patients and families have a right to expect. And we are being first adopters, including groundbreaking technologies from partners like Varian that will revolutionize the way we treat cancer. Cancer patients in Nova Scotia will experience the first in the world Ethos radiotherapy system with hypersite imaging. This technology could mean a reduction in the number of radiation treatment sessions from the standard 20 down to just 5. Together with our partners at the Innovation Hub, we're not just witnessing change, we are steering it. It's difficult to invest wisely if you're working with one hand tied behind your back. To invest wisely, We need the data. We need to establish outcomes, key performance indicators, and we need to ask how we are holding people to account. We've had to build the system to get the data. Think about this. When I came into government, the only way staff in the hospitals knew if beds were free was to call around from department to department, searching for an empty bed. In response, we built a healthcare command center so all beds and all movement can be tracked in real time. Our healthcare system has lots of information, but until it's converted to usable data, the system can't be properly managed. Well, we've got to work and we're getting the data. With more data, we will be able to provide better, faster care. Human resources, access, technology, data. That's the blueprint to fixing healthcare. And one of the things I look for in others, particularly in healthcare, are those who share that same sense of urgency. Because in my experience, there are really only two types of people. There are problem stretchers and problem solvers. Problem stretchers will tell you 1,000 reasons why you can't do something. Problem solvers already know those 1,000 reasons, and they find ways to push through them every single day. Those are the people I want in my corner, in my government, as we fix our toughest challenges together. So my message for you today is that whatever issues we face in healthcare, this is a leadership test that we can and must pass, and we will. I'm here today to tell you it can be fixed, and we're well on our way to fixing it.